James Bartholomew has spent the past decade studying Britain's state sector. As he points out, the biggest state monopoly outside communist China is the NHS.
Monopolies tend to do badly, state monopolies tend to do worst of all. We've now become one of the, if not the, worst healthcare system in the advanced world. Worst in pretty well every respect you can think of. We have fewer MRI scanners by far than average. We have fewer beds. We have fewer acute hospital beds. We treat fewer people with fewer cancer drugs and we give them less of them. When they go to their doctor, they don't realise that they're being diagnosed late, that they're being treated late, that they're getting poor rate of radiotherapy, that they're getting out-of-date cancer drugs. They don't know this. They're innocents, many of whom are dying without knowing it's the fault of the NHS.
I've come to a health tourism show in Olympia. In these days of cheap travel, it's easy to hop on a plane and head abroad for your cancer treatment, say, to a country with much higher cancer survival rates, in hospitals that look more like five-star hotels, and all for little more than the cost of a holiday.
See you again. Bye.
Today we have Saturday, okay, and if a patient is coming here, British patient is coming, I have a serious problem, this and this and this, he can come on Monday and we're going to start immediately.
Does the NHS go to Germany trying to find patients? Do you find many patients wanting to come to England for treatment?
I think Germans would not go to England for treatment, no.
The NHS is the most monopolised state provision in the advanced world, and it is the worst system in the advanced world, the least successful system in terms of treating people well, and indeed treating the poor. So it is the most state-controlled and the worst. There is a connection between these two things.
People say we need a state health system in order to provide healthcare for the poor. Is that true?
In Germany we have a health insured system.
So all Germans must have health insurance?
There's a law that everybody who lives in Germany, not necessarily Germans, but everybody who lives in Germany needs to have health insurance.
What happens if they're poor and they can't afford it?
The state is paying the health insurance. Even if you're poor, unfortunately you get sick, yeah, and then you get the medical treatment, of course, yes.
We don't need to have a nationalised monopoly to treat the poor. They're treated in France, they're treated in Germany, in Italy, all around the world. Advanced countries look after the poor. You don't have to be a state monopoly. You can have an insurance system. That's become the norm in Europe.